Sándor Ferenczi wrote his clinical diary in the final, restless years of his life. He had been one of the inner circle of early psychoanalysis, a clinician who began within orthodox technique and then moved, with increasing urgency, toward a clinical practice that foregrounded human suffering above theoretical neatness. The diary reads like a clinician's notebook crossed with moral confession. It is not a tidy treatise, nor a programmatic manifesto. It is an urgent, immediate document composed of fragments, session notes, rapid verbs of feeling, dream reports, short theoretical riffs, and repeated returns to the same stubborn clinical questions. Ferenczi recorded what patients said and what they did. He also recorded the precise way those patients affected him. He was not satisfied with the old instruction to bracket the analyst's interior life. He experimented with making it clinical data. That move is part of what made his entries so controversial and so fertile. 3 large thematic threads run through the diary and help the reader navigate its apparent disorder. His clinical attention to trauma and its literal origins in life events, his radical candor about countertransference, and his practical rethinking of technique, especially what he called active and mutual approaches. Trauma is central to Ferenczi's thinking. He insisted early that some neurotic symptoms are the direct sequelae of concrete events, abuse, neglect, physical violation, rather than purely intrapsychic fantasy. He developed the idea of a confusion of tongues to explain how adults sometimes speak to children in a sexual or coercive register the child cannot comprehend, a linguistic violence that leaves the child bewildered and damaged. In a diary, he repeatedly returns to the clinical shape of this damage. The fracture in trust, the collapse of symbolization, the alternation between numbness and catastrophic effect. He explores what happens when the nervous system is overwhelmed by experiences that cannot be integrated into meaning. The second theme, countertransference, is treated with rare frankness. Where many contemporaries advocated a strict analytic neutrality, Ferenczi recorded his own shame, desire, impotence, and rage. He wrote about being moved to tears by a patient's pain, about being aroused by a patient's sexuality, and about feeling compelled to act when an analytic silence felt like a cruelty. He did not regard these reactions as contaminating noise to be suppressed. Instead, he treated them as instruments that could help him understand the patient's unconscious. This repositioning of the analyst's feelings foreshadowed relational and intersubjective developments in later psychoanalysis. The third major theme is technique. Ferenczi tested what he called active technique, interventions that go beyond the interpretive stance when a patient is stuck, dissociated, or unable to access meanings through usual analytic routes. He also recorded experiments with mutual analysis, selective, carefully considered reciprocities of disclosure, and a loosening of rigid abstinence. These techniques had a logic. If trauma disrupts symbolization, the analyst's responsiveness must sometimes provide a corrective experience, an emotional scaffolding that makes remembering and telling possible. The diary thus argues that technique must bend to the needs of the traumatized individual, not the other way around. Beyond these 3 organizing ideas, the diary is remarkable for tone. Ferenczi's style alternates between pragmatic clinical detail, what was said, how a sentence landed, how a patient breathed, and broader ethical reflection on the duties of the healer. He documents small but telling clinical moves, repeating a phrase that calms, offering a touch that anchors, allowing a silence to contain. He is methodical about noticing how a pause or a change in posture signals regression. He also records his own personal strain, insomnia, fatigue, moments of moral panic, so the reader sees how the analyst's condition influences clinical choices. This opening section closes with a short reflective summary. The clinical diary is less a manual than an honest, messy argument for clinical flexibility. It invites clinicians to notice their own interior reactions. It insists that trauma needs more than elegant theory, and it sets the stage for the more detailed clinical episodes and technical lessons that follow. The core of the diary is clinical vignette after vignette. Ferenczi gives us many brief session sketches and a few extended case threads. Across these pages, we meet several recurring patient constellations, adults who bear the aftermath of childhood sexual violation, people whose defenses calcify into dissociation, fragmentation, or numbness, and patients whose current symptoms trace directly to early attachment ruptures. One pivotal case described in the diary involves a woman whose repeated early violations produced alternating states of numb withdrawal and explosive anger. Traditional interpretation had left her stuck. Ferenczi describes in clinical detail his attempt to name the abuse plainly, to validate the patient's shame, and to allow more immediate, embodied responses in the session. Words, gestures, and contained presence that together made a small corrective experience possible. In that entry, he reports that direct naming sometimes loosened effect when interpretation alone could not, and that the patient's capacity for representation expanded slowly after these interventions. Another instructive case concerns a younger man who repeatedly enacted his trauma within the analytic frame. He provoked, tested boundaries, and then withdrew. Ferenczi records that these enactments stirred punitive impulses in him. He did not occult those impulses. He wrote them down, examined them as clinical signals, and at times offered frank apologies when his own reactions compromised the alliance. Those apologies are not mere confessional flourishes. In the diary, they function as therapeutic acts that sometimes restore trust. Several vignettes highlight how small, embodied interventions can matter. A carefully timed repetition of a phrase, a brief physical contact offered in extreme distress, an interpretive phrasing given with parental calm. Ferenczi's entries map microprocesses in the consulting room. Changes in respiration, shifts in cadence, the appearance of a particular metaphor that become windows onto implicit relational patterns. He is attentive to regression, which he treats ambivalently. Regression can replay trauma. It can also, when managed, permit the recovery of disavowed material. That ambivalence informs his choice to move from a neutral stance to active interventions on occasion, always with a concurrent ethical deliberation captured in the diary. The text also offers glimpses of his tensions with contemporaries. Ferenczi admired Freud, but increasingly found Freud's strict neutrality insufficient for treating traumatized patients. The diary documents disagreements, the loneliness of dissent, and a complex web of friendships and rivalries among analysts that shaped how his ideas were received. He also records consultations with colleagues and the real-world consequences of testing limits. Some patients improved after his departures from orthodoxy. Others suffered ruptures that required repair. Ferenczi is unflinching about those mixed outcomes. He does not provide a checklist for clinicians. Rather, he offers a laboratory of reflection. The ethical implications are thick in these pages. He explores the possibilities and perils of boundary adjustments. He admits mistakes and learns publicly from them. This humility is an important lesson in itself. The clinical vignettes make Ferenczi's method concrete. They show a clinician willing to risk conventional safety for patient contact. They also demonstrate an ethic of humility. He records errors and learns from them. And the diary, in that sense, is both a practical manual of observation and a moral document about the responsibilities of therapeutic intimacy. The final section of the clinical diary weighs its theoretical consequences and practical legacy. when read together. The entries form an argument rather than an anecdotal miscellany. Ferenczi's insistence that trauma must be taken literally reshaped later trauma theory and open space for clinical practices that prioritize repair over abstract insight alone. He emphasized that repeated early harm produces structural vulnerabilities, gaps in trust, capacity for symbolization, and bodily regulation, which cannot be resolved merely by interpreting fantasies. Second, his treatment of countertransference moved what had been a tolerated nuisance into a central clinical instrument. By treating his own feelings as data, Ferenczi showed how the analyst's responses can reveal the effective organization of the patient's unconscious world. This stance influenced later schools that foreground intersubjectivity and mutual recognition, and it anticipated contemporary approaches which integrate therapist subjectivity into the therapeutic method. Third, his technical experiments, carefully attuned active interventions, selective disclosure and controlled mutual analysis, and tactical uses of physical comfort when the patient is overwhelmed, anticipated pragmatic therapies that blend corrective experience with interpretive depth. Ferenczi never argued for abandoning depth psychology. He argued for enriching it with responsiveness and corrective relational work. The diary also issues moral cautions. Radical disclosure and boundary flexibility can sometimes heal. They can sometimes harm. Ferenczi was aware of both outcomes, and he used his failures as material for ongoing clinical learning. Readers should attend to his repeated injunctions about containment. Honesty must be balanced with the capacity to hold a patient's effective collapse. He models a temperate path. Speak plainly when a patient can bear truth. Postpone disclosure when it risks collapse. Historically, the diary reframes Ferenczi's place among early analysts. It resists a simplistic canonization or vilification. Instead, it presents an intelligent clinician wrestling with urgent suffering and with the limits of the methods available to him. In contemporary practice, the diary continues to speak. Trauma clinicians, somatically oriented therapists, and relational psychoanalysts still draw on Ferenczi's insistence on gentleness, on active repair, and on the moral responsibility of the analyst. For practitioners, it offers concrete advice. Attend to the body, name traumatic events plainly when safe, use countertransference as information, and allow technique to be responsive rather than rigid. For theorists, it prompts rethinking about the interface between external reality and internal fantasy in symptom formation. The book is not perfect. It contains morally ambiguous experiments and clinical risks that demand critical reading. But its strengths are durable, intellectual honesty, a finely observed clinical sensibility, and a relentless commitment to relieving the isolated suffering of the patient. As a final, brief reflection, the clinical diary is a raw, brave, and indispensable text for anyone who treats trauma or who cares about the ethical demands of psychotherapy. It combines a clinician's specificity with a philosopher's urgency, and it rewards readers who are willing to work through its difficult passages with patience and care. For further reading, the book is available via the link in the description.